Obesity leads to inflammation. Not obesity leads to not inflammation. So I think it's very important to look at the synergy between a healthy lifestyle, nutrition, and the potential for cell therapy when needed. And that's what we're trying to explore together.
Hey guys, it's Haylie here. And boy, do I have some power to put on your plate today. We are going to tackle the subject of autoimmune disease. Don't worry, I'm not tackling it alone. I have brought some of the most brilliant doctors and even a client of mine, a mutual patient and client of ours, to the table today. I want to talk about, what is the autoimmune disorder? It could be something like lupus, dermatomyositis, celiac disease, my ITP like myself, MS, type 1 diabetes. But an autoimmune disease is when your body is actually attacking itself. So your immune system should be attacking like foreign invaders. But with autoimmune disorders, it actually attacks your own tissue. It could be your lungs, it could be your joints, it could be your platelets, like with myself. And one thing that's kind of interesting is that it's a 2-to-1 ratio with women to men that end up having an autoimmune disorder. And most commonly, it happens when we're having some sort of hormone transition. So we see it in young people with the onset of periods. We see it sometimes during pregnancy. And most commonly, we see it a lot during menopause. In the United States, about 24 million people will be diagnosed or will have autoimmune disorders this year. And in our community, it's all about finding solutions and ideas and being progressive and putting that power in your hand. And so that's why today I'm bringing some very unique people. There's going to be 4 of us. It's going to be quite an eclectic discussion because I want to bring up a therapy that maybe a lot of you guys haven't been exposed to. And that's what we're seeing in many other countries. And now we're starting to see in the United States. And that's stem cell therapy and its effect on re-regulating a body that's suffering from an autoimmune disorder. So we're lucky to have Dr. Rafael Gonzalez. He is a biochemist, a cell expert that has extensive knowledge in the stem cell health. He is responsible for developing several clinical trials, both in the United States and out of the country. So maybe you've heard of cell therapies for, joints or anti-aging, but a lot of the progressive therapies are in severe treatment for diseases that we don't really have a lot of restorative or reparative drug therapies for. So that's why I brought on to this conversation Dr. Keith March. Dr. March has over 60 worldwide medical patents. 10 million patients have used his patch where it patches the blood vessels after having a stent. He comes from the world of cardiology. He's had 2 decades in development and research in the world of adult stem cell therapies. And right now, he and Dr. Gonzalez have this phenomenal trial that's being started at University of Florida around how stem cells can be applied in the autoimmune world. I also have one of my clients. Her name is Karen. She's been a client for a very long time. And I have had the pleasure of walking on her journey through being diagnosed with an autoimmune disorder, being given prednisone, Imurin, Cellcept, all of the anti-rejection drugs, Mepron, and her tenacious desire to accept nothing but getting back to health. And so Karen's going to share a little bit of her journey with us and what motivated Dr. March and Dr. Gonzalez, 2 brilliant researchers in the stem cell world, to come together to help give you guys the information to put some power on your plate. So join me while we dissect this really complicated concept of being really progressive in the world of autoimmune disorders. It's been an amazing journey for myself, and I cannot wait to share these brilliant people with you. Very excited for myself, for my client that I have here today, for our community. I wanted to bring everybody into my kitchen. This is my classroom. It's been my pharmacy and my own health journey. And for us as a community coming together, it's all about putting power on your plate. And when we put power on our plate, sometimes that's in the form of food. Sometimes it's in the form of success boosters or things that you can do to help enhance your body, your immune system. And today we're going to talk about the power of choice and the power of knowledge and the power of looking at options in your health and wellness. And so I just want to introduce a couple of cherished individuals in my life. I have today Dr. Rafael Gonzalez. I have Dr. Keith March, and I have Karen, who's been a client of mine for many, many years. And thank you guys, and thank you so much for being here today. I appreciate each of you. I wanted to get together and talk a little bit about autoimmune disease, autoimmune disorders, why it's happening, why it's so prevalent, why many of us are struggling with it, and bring some of the brightest minds that I've had the privilege of working with together and see if we can't provide you guys with some ideas or options or choices in your own particular healthcare. So welcome everybody. And Karen, I would just kind of like to start with you really quick. So you are a client of mine. When our community, I like to bring in, all of what I call our virtual clients, all of our doctor friends, all of our different individuals that incorporate different therapies. But Karen, I just want to thank you for coming today as a client and as a fellow autoimmuner, and just, kind of thank you for being here. I really want to thank you. And it's very exciting to have you.
Thank you for having me.
Absolutely. So Karen, let me share a little bit about how all of us came to be in working together. So Karen and I were working together on health and wellness, and Karen, had what we would call kind of the perfect storm, right, Karen? So you were dealing with some health issues, but just everyday things that normal people deal with, maybe a little bit of fatigue, working on your health. And then you got really, really sick. Can you share with us a little bit of what happened with that?
Sure. Probably almost 10 years ago, I got really sick with an autoimmune disease. I was in my 50s, and apparently that's a very common year to get an autoimmune disease, and mostly affects us women. So I was surprised that all of a sudden I had perfect health. At least I thought I did. And then all of a sudden I became very sick. And so I thought that, I go to the hospital and the doctors treat you, give you pills, and you get better. Well, that didn't happen with me. They said to me, once I got over the initial big inflammation storm that came, they said, we're going to put you on medication for the rest of your life. We're going to suppress your immune system, and you have an autoimmune disease, and the only way to treat this is with six medications. And so initially they started me with prednisone, which anybody knows about prednisone, puts you a ton of weight on, makes you puffy and really irritable. So, and then they phased me off of that, and they put me on some other immune suppression. And, I figured that, maybe a year goes by, they said to me, you might be able to come off your meds. Well, time went by, and they started phasing me down my medications, and the disease came right back. And my disease is an autoimmune disease that is called dermatomyositis or polymyositis, which affects the lungs. So I couldn't really ignore the symptoms that I had, because I wouldn't be able to breathe, and I'd need a lung transplant if I didn't pay attention to medicating myself. So I was forced into this medical world that I was, as a healthy person, have never navigated before.
Right.
Who would help me through that, Haylie?
Oh, thank you. We've been through quite a journey. That is for sure. And Karen, I brought on Dr. Gonzalez today and Dr. March today because they've been very integral in us finding kind of innovative ways to deal with both of our autoimmune disorders. And our community is, God, some of the biggest questions that we get asked on a regular basis is, what do I do? How do I survive the disease, survive the treatment? And I always say, how do you thrive in this kind of an environment? If I can take like a little step back really quick, and Dr. Gonzalez, if I can start with you first, and we can talk a little bit about, what do you see in the immune system, or what's going on in the immune system when we start to create an autoimmune disorder, or basically the body starts attacking itself?
Correct. Yeah, and essentially what we're looking at is there's many different hypotheses as far as what's transpiring in autoimmune, but there's really no known cause. One of the biggest ones is looking at, viruses, the possibility of a virus coming in and then mimicking, coming integrated with your own DNA and then mimicking something that seems like it's you, but it's really not you. Then the body then comes in and targets it and then recognize this thing as being foreign when it's actually you. And it's just targeting you, and then killing and destructing tissue. There's many known autoimmune diseases. We all hear commonly of rheumatoid arthritis, lupus. One of these ones right here is polymyositis, dermatomyositis that we're just talking with Karen. And they all somewhat have, there's similarities. There's some similarities, but yet they're different because the targets are different and what transpires over time is different. We here look at the immune system as number one key to health. I work in the stem cell sector and the cell therapeutic sector, and we look at the immune system as a key to health, and the most important thing that we can actually do is maintain immune health. And the reason being is because every single disease, every single thing that transpires has an immune component to it. So we target that. And we look at that. Right now, we are in a phase 1 clinical study that I've been fortunate to meet with and work with Dr. Keith Marsh at the University of Florida, where we're using a particular stem cell that we have a patent technology on. And it's actually doing a clinical study for polymyositis, dermatomyositis in patients such as Karen, which Karen has been, we've been blessed, really, really blessed to meet both of you and speak with both of you. To be able to bring this to fruition for many individuals. And the reason being, one of the reasons is because these cells have properties to control the immune system, modulate them, not do what Karen just said, which is just keep me in a suppressed immune state. Because then there's secondary effects. If we think of the common drugs that are out there, we suppress the immune system. I now put somebody that's been suppressed of the immune system in the probability of getting cancer somewhere later on down the line because the immune system is not functioning properly, or many other different disorders that are out there that we come in contact with on a daily basis. So ultimately, we look at modulating the immune system.
Okay, so I'm just going to take a step back just for a second for our community. And what you said, I get very excited. I always say I science geek out about this kind of stuff. So basically an individual like myself or like Karen, all of a sudden we've been diagnosed with an autoimmune disorder. Mine was early when I was 19. Karen shared that hers was in her 50s, which is very common. It's a 2-to-1 ratio for women to men. It's very common when we're going through some sort of a hormone transition, either onset of periods, pregnancy, menopause. Those are common. So if I'm hearing you correctly, Dr. Gonzalez, what we're seeing in those situations is a dysregulation of the immune system. We're pro-inflammatory and our body is attacking ourselves. And you brought into the conversation a little bit about using stem cells or cell therapy, which Karen and I have both had a lot of exposure and experience with, as a way to re-regulate the immune system. So we're not looking in this kind of a situation. And again, Karen, maybe you can share that with my role in working with my clients. I'm looking for a way for the body to create a healthy homeostasis, not necessarily for a suppression of what's going on. I want to figure out the why. I don't want to figure out the how. And Dr. March, you have had over 2 decades of research working with adult stem cells specifically and leading incredible laboratory efforts. I just want to ask you a couple questions since Dr. Gonzalez brought stem cells into the conversation here. So in my world, a lot of my clients, and I've traveled with a lot of my clients, we have to go out of the country for therapies like this to even be an option. I'm going to just back 2 things up really quick before I give you the punchline of my question. In the autoimmune world, there are a lot of drug therapies that I share with my community that I've been exposed to. Karen just shared that she's been exposed to. In a lot of other countries, there are different biologic therapies that have been used very successfully in the autoimmune world. Mesenchymal stem cells is one of them. And as Rafael just said, we're talking about a study that you guys are working on together. Can I just ask you, for my community, in all of your vast research, what is the mechanism that we're hoping to reprogram in the body so that it stops attacking itself?
Sure. Thanks so much. Thank you for that.
Softball. Yeah.
Thank you, Haylie, for the chance to be here with you and Rafael and Karen. It's wonderful. So I like to think of those cells as being like the repair stations on the highways of the body, which are the blood vessels. So these blood vessels go everywhere throughout the body, and these cells line those blood vessels, the mesenchymal stem cells. And the particular kind we're working with that Rafael has made are actually derived from the umbilical cord. And the umbilical cord itself, of course, has blood vessels within it, and it's the ones that line those blood vessels that we're using. Again, these cells throughout the body are importantly involved in regulating and modulating, as we said, immunomodulation, how much access and how much trafficking there is of the various inflammatory cells, are what are called our white cells, our leukocytes, which include both lymphocytes, monocytes, some of these other terms, how much access they do get and in what way they traffic into the tissues of our body. So I like to think of these also not only as repair stations, but kind of governors of entry and access to those tissues of the body. And when there is a dysregulation, meaning an abnormal function of some element of immunity, the autoimmunity, as you're talking about, what we found is that adding the mesenchymal stem cells appear in many, many different models of disease, and also, as you said, in other countries, to be able to downregulate, to modulate that autoimmunity so as to protect the body. So what we're really using is something that the body naturally does with these lining cells, the mesenchymal stem cells, or stromal cells as they're also called, but we're providing more of them. We're using a natural protection mechanism, if you will, to modulate the immunity, to change the immunity for the better.
So help me if and I just try to distill this down in my brain. So something has gone awry. I'm going to distill it down just here for a second. And when and usually, like Dr. Gonzalez said, it can be viral, it can be infectious. I feel like mine was chemical. And when I did a lot of different chemical assays, as I was going through the autoimmune process, I have ITP, it was attacking my platelets. And there was, it was very odd. We did this whole chemical profile, and they said, gosh, you have this really strong insecticide in your bloodstream, and the counts are weird and the values are strange. And I actually had been exposed. They were spraying for Met flies. I don't know if you remember, Dr. Gonzalez, in California, they were spraying. They did this whole thing where you had to be inside. Well, a bunch of friends and I was 17 and just coming 18. We're out and about past curfew, and we got dumped on. And I'll never forget, it was this orange spray, and we got covered. And I, as I was going through kind of rebalancing or re-regulating my own immune system, those levels were both found in tissue and in blood as residual. So I always felt like that was, and there was also a lot of stress in my life during that time, that was the perfect storm. And Karen, I know you've shared, or we've talked a lot about what you maybe feel like was your perfect storm that caused the body to go into this dysregulation.
Yeah. One of the things you mentioned, chemicals. I think that mine was potentially a bacterial virus. I think I got bit by a tick, which kicked off my immune system. I had high stress. I had tons of food allergies. My gut was inflamed. I had heavy metals. And, that's one of the things that I feel kind of got my immune system off. And, that's another reason why coming to you. I mean, you basically ripped all my goody foods out of me and whipped me into shape, took out my dairy's gone, my gluten's gone, my soy's gone, my corn's gone. But that all helped calm my immune system and make me able to kind of work the program that we've been going on. It's because my diet with stress reduction has helped get me down, not from solving it all, but it definitely helps. It's one of the steps you need.
So in your case, and we've all kind of talked about Karen's case a lot in watching through this process. So we had a sudden onset of extreme dysregulation in her immune system. She, her hands swelled, her knees swelled. She had been bitten by a tick. She had already like a lot of, food allergies and maybe sensitivities and things of that nature. So if you guys can explain to me, if you gentlemen don't mind. So basically the option for me was, prednisone, Imurin, Cellcept. With Karen, it was very similar. And then a lot of Mepron on top of it. When the body goes into that status and the protocol or approach is going to be, a regimen of autoimmune meds, is there any chance at that point to re-regulate? Like Karen said, we worked on stress reduction. We worked on food and diet, which I think is, as the foundation for health. But is there any possibility so one of the reasons why we both sought out stem cells was because we were like, look, we can eat like angels and, de-stress and do everything that's possible to try to get on no drugs or as little drugs as possible, just because of the side effects and the issues that, being vibrant, bright, brilliant women, we didn't want to experience. But we were really looking for a way to re-regulate the immune system to get to what I want to call pre-autoimmune disorder. And is that what we're looking for in these trials with the stem cells?
One of the things that we've seen and many others have in the field, including in particular some of the clinical trials that have been done in other countries that we're now looking to expand and extend in this country with FDA authorization, is that it appears when you provide the MSCs, the mesenchymal stem or stromal cells, as they're called, to the system, it does do a prolonged reset of the immune system. So you can provide the cells at one point, and the effect that changes the way immunity is regulated over time appears to last for weeks or months after that provision. Now, it's probably not necessarily permanent. It is highly likely, as best as we and others believe at this moment, that it's going to require redosing, like almost everything in medicine does. But it's very interesting. The cells themselves have an impact that is prolonged with regard to changing the cells of the immune system from being very active, the ones that we call effector cells, for example, in the world of T cells, if you're familiar with that, towards those that are called the regulatory cells, the ones that actually decrease the immune reactivity. And that can be persistent. So it's not like one shot and, you
right.
have to repeat it every day. It really prolongs, and it seems like there's a degree of reset, kind of to talk
right.
to your point.
It's essentially, I'm taking and I'm going to put a conductor into your immune system. And this conductor is now going to regulate what is going to happen in there, that I don't allow that strong pro-inflammatory response. Instead of, if I give you a drug or these drugs that are available out there, I'm going to consistently keep your immune system suppressed to stop that discontrol that's happening right now. Yet there's effects of that. But if I could throw that conductor in there and I can say, okay, this amount of immune pro-inflammatory response is okay, this amount of anti-inflammatory response is okay, let's keep our bodies at homeostasis, which, going back to one important thing that you just described is, and actually Keith just said actually too, was this is not a cure, first and foremost. This is it's a therapy. It's a therapy, but it's a natural therapy, which is what makes it nice as fun. And secondly, if you don't eat right, and if nutrition is put into the key the right way, you probably have triggers in there that you have gluten sensitivities or whatever it may be, that you all of a sudden eat something and you now trigger that immune response again. It's like a combination of package of Haylie works, we work together in collaboration of, you get the nutrition right, and then we give them these cells to hopefully try to help and better their symptoms.
I was just going to say, extending what Rafael just said, I thought, the conductor analogy is really cool. One of the things that you can think about with the way these cells work is that the cells, as I mentioned, like repair stations, have a lot of different tools in them. Well, if you like to use the conductor analogy, the cells secrete a lot of different molecules. Those are their tools. They might be called peptides or small molecules, enzymes, microRNAs, mRNAs, all of these are contained by the cells. And that scenario in which they're secreting a variety of molecules really acts like a symphony. So instead of with a standard pharmacological approach, which is not biologic, you're attacking one particular mechanism or one particular target or set of small number of targets. Instead, you have a symphony of instruments which the cells are secreting. And all of these tools work together. So just like in the case of a single loud instrument like the tuba, it's very loud. There's one thing playing. Here you have a symphony of a lot of things working at a low level or a moderate level, but it still makes a big sound. They're all working together, which we believe in general will also help the way they work and decrease adverse side effects.
Let me say something really quick. This is what I think tell me if this buttons it up a little bit here. So in my experience, we look at removing the insult, we look at restoring the body, creating a healthy ecosystem through nutrition and natural therapies. And in my clinical practice, where we started seeking out different types of therapies, and unfortunately, until you guys started these studies in the United States, seeking them out in other countries, was with autoimmune specifically, we had a heck of a time rebalancing the body. So all of us, and we talk a lot about this in our community, a lot of us with autoimmune disorders live in this world of what we call fear of the flare. And what that means is, are we going to break through the prednisone? Are we going to break through the Imurin or the Cellcept? Is the disease going to progress because of having a stress that we don't have control over? And so with the cell therapies that I started kind of looking at in my clinic and bringing in different ideas or options for people. We don't do them in house, obviously. But where I just started contacting individuals and Dr. Gonzalez, where I started reaching out, was because with autoimmunity, there's this rebalancing that felt so elusive. And over the years that I've watched clients go through stem cell therapies, there seems to be a lot more stability in that rebalancing option. It doesn't seem to be as fragile as it is as it feels in the autoimmune world. Karen, would you say that was kind of the experience that you've had?
Yes, and I just would like to point out that by taking, as which I know we're going to get into,
how did stem cells get brought up to you? How did that even come into your world?
I had met some other doctors who had talked to me about saying that you might want to look into them, and then I was connected up with Dr. Gonzalez. And I wanted to find out how does this therapy actually reduce inflammation? Because my whole problem with an autoimmune disease is inflammation. And inflammation to the point, as you mentioned earlier, my hands swelled up, my knees swelled up, I couldn't breathe. So I want to know how I get rid of this flare, this storm. And it looked pretty exciting that these stem cells could possibly help me.
Yeah, and I distinctively remember that you were having visits with your doctors, and we were kind of going, okay, what's next? We were somewhat stable from an immune perspective, but on max doses of meds, and we were like, okay, both very excited about what was the plan from here. So now what do we do? Now how do we get her healthy? And we first were looking at all kinds of different research out of the country. I mean, we were looking at some stuff that was happening in Spain and in China and in Moscow, a lot of different areas. What kind of a response did you get when you broached the subject with your rheumatologist and your pulmonologist? How did they feel when you said, look, I'm thinking about doing something that's definitely outside of the box?
Well, they definitely thought I was crazy.
I want to just take a little step back for a second. So we've kind of loosely mentioned that there is a trial going on, and Karen, Dr. Gonzalez, Dr. March, you're all involved in it in a unique way. So let's say I'm someone in my community is dealing with autoimmune disorder, and they're thinking like, I would like to incorporate as many types of therapies that can drive me towards wellness on my wellness journey. And an individual says, maybe I'd like to try stem cells, or maybe I've thought of stem cells. And right now, I know that specifically the two of you are working together on the trial specifically with dermatomyositis and polymyositis. Should we define that a little bit? Or Karen, you could even share some of your personal experience with that disease, uniquely. But let's kind of unwrap that one a little bit.
What we're doing is a phase 1 trial, and our purpose with the trial is to build on the data and the findings that have been either reported in publications or also anecdotal from other countries, so that we can determine here under FDA authorized clinical trial rubric how well these cells work and to what extent they work. And that's the basic question. For whom are they going to be effective? Are they effective? How effective? Let's actually establish that in this country. And so the way you begin is to do what we're doing right now, what's called a phase 1, first in human trial in this country for this cell type for dermatomyositis and polymyositis. And so the people that we hope to address are anyone who's 18 years old or older with a diagnosis of dermatomyositis and polymyositis, either one of those, that are either definite or probable in their diagnosis. And those patients would typically have either a myositis-associated antibody, or we've evaluated their disease process with their rheumatologist to exclude other things that can mimic polymyositis or dermatomyositis. So in other words, we try to understand that they actually have that diagnosis, and then we're going to enroll them in this trial looking for safety predominantly, and also some effects in terms of, for example, their pain, their strength, the release of enzymes that denote muscle damage, all of those kinds of things. And so that's what we're hoping to do in the next period of this, say within the next few months to a year, looking at this first set of deliveries in 9 patients. After that, we'll evaluate the safety and any hint we have of whether there seems to be efficacy that we've been able to reproduce. If so, then we'll approach the FDA and move forward to the next stage.
So Dr. March, if I have someone in my community who wants to participate in this, it's at University of Florida, and how would they, I want to bring this to our community, but how would they be involved in this? Would they call you? Would they, I always say, www.helpme. Those of us that have autoimmune disorders, I feel like sometimes that's what we do while we're in the middle of a fear of the flare. How would they reach out to you specifically?
Well, specifically, we'll provide you with the phone number that they can call, so we can put that up and let it be very clear.
Okay.
And anyone who has concern about dermatomyositis, polymyositis, those are the people we want to be able to see whether or not this might be something that could be helpful. That's the whole purpose of the clinical trials, to determine, is this helpful or not? And if it is, as I said, we move forward.
I can feel like right now that everybody in our community that is dealing with autoimmune disorders, whether it's lupus or dermatomyositis or celiac disease or ITP like myself, they're going to say, this is really exciting that this trial and this study is going forward, and that you guys are actively looking for individuals. So you guys, if you're out there and you feel like you have a diagnosis with dermatomyositis or polymyositis, or you seem to fit that profile and you want to connect with a good rheumatologist to see if that's right, and then you think like myself and like Karen, you're wanting to do something, some sort of therapy that can help re-regulate your immune system. I know a lot of people are going to be asking, maybe I don't have that diagnosis, but what's next? Why is it important to do this study? And how is it going to help people that have something like maybe lupus?
So this is essentially going to look at a particular autoimmune disease and its safety of it. And once we have that safety established and some form of efficacy, like I said earlier, there's a crossover with many different autoimmune diseases. And, one of the largest autoimmune diseases out there, the most prominent amount of people have rheumatoid arthritis. Then it either goes to either multiple sclerosis and lupus, and then down the line. Diabetes type 1 is actually relatively prominent too. And there's many of them that essentially the immune system, once again, we go back to it goes, out of balance, and it attacks the body and causes different things. Once we show that this is safe, that us as a company, ReStem as a company, makes a decision, which we are making that decision, of moving forward with other clinical studies. The nice thing about this key study is that it gives us the possibility and the probability of going into a phase 2 for these different autoimmune diseases, whether it be lupus, whether it be rheumatoid arthritis, multiple sclerosis, etc., that we go straight into a phase 2 where we look at efficacy in this. Another issue with and Keith is probably gonna, and I'm gonna ask Keith to chime in on this too, is these things cost a lot of money, and we need support to fund these studies. But eventually we have to go to the table and go back, hey, help us out, whoever have these, the associations, the parties, the universities, and try to work together to be able to afford these clinical studies that actually run millions of dollars. But it's our goal to actually move forward with various different autoimmune diseases, because we truly believe that this will work for autoimmune disease, that it's a natural form of maintaining a quality of life.
Yeah, we definitely would love to build out a portfolio of these exact type of FDA authorized clinical studies to evaluate safety and efficacy across a range of autoimmune diseases, because those are so prominent, and these cells appear to be so effective in doing immunomodulation. So we need to see what disease does that work well in, which ones or not, and that's what we're about. And so it's a great synergy of intent that we have among all of us on this discussion.
So right now, and that could not be said more eloquently, Dr. March, the intent here is to, I always say, it was a struggle, and I've watched my clients struggle through all of the complexity of autoimmune disorder and that dysregulation that you both have talked so eloquently about. And so right now, for any community member that's listening, they can participate in this particular trial or study. And the goal there is then for this to beget more studies, and then ultimately to be able to integrate this type of therapy into a portfolio of options of care for someone like myself that deals with autoimmune disorder. Karen, can I ask you kind of a really personal question? So Dr. March just talked about the reason why he's doing this and the reason why Dr. Gonzalez is doing this. And I just want to ask you, what has led you to really push forth this therapy in the United States when you could just go out of the country and continue with your glorious life?
Well, what I decided that I was too young to be living on immune suppression and possibly getting cancer or other side effects of immune suppression. It's got to be able to help other people. So I feel that with this cell therapy, it needs to be legal in the United States. It's currently not. It's in trials, it's legal. Like, it's FDA approved trials. This is an FDA approved trial, and the government has said, go ahead and do it. We can take 9 people in the trial, and for safety. Then efficacy, which means, does it work? So then they can go to phase 2. The exciting thing about this is, once this trial goes through and it's approved, they can use it, and while it's going, they can also authorize use for other things like lupus, for diabetes, for MS. But we have to be the pioneer out there and get it out there. And so I just want everybody else to be able to get the benefits of what I'm getting, because I feel a hell of a lot better. I feel healthier. I've been able to reduce my medications, and I'm not saying this happens for everybody. It's just I'm telling you my story. And I just would like to have other people have the same opportunities.
Yes, and Karen, you can call yourself a pioneer all you want. I'm going to call you an angel. We're also privileged. What was that, Dr. Gonzalez?
Angel,
yeah, a pioneer angel. We have all been so fortunate to be on your health journey with you, and I think it's always inspirational. But I think the thing that is been kind of so touching for all of us is that you don't just want this for you, you want this accessibility for other people. And I know that you have been the driving force in getting everybody together to make this study be able to happen. And Dr. March and Dr. Gonzalez, as this is happening currently right now, as we're working on the process, or as you're working on the process of filling this trial, what would each of you individually say to somebody that would think, okay, let me just say one thing. I cannot believe how hard it is to learn about trials that are available, for your health and wellness. And I have almost never seen a doctor outside of maybe a trial in cancer therapy, a drug therapy, recommend one of my clients for a trial. We are constantly scouring and combing databases and knowledge to try to figure out how to get people access to this. I can't, we don't have enough time to talk about, Dr. Gonzalez, how we finally got in contact with you, and we've been so fortunate since then to get to work with you. But if each of you could share with me, what does a person need to do to be able to participate in something like this?
Be proactive first and foremost. Number two, start off with baby steps as far as nutrition. Nutrition is the most important thing that you can do. Working with individuals such as Haylie, being part of her group, her network is the biggest start that you can actually take. And then secondarily, looking at, we said, like I just said, going online and being proactive.
Thank you. And Dr. March, specifically with your trial, Karen wants to have other people realize the same success that she's had. So what would you say to a person that's maybe one never heard of stem cells or thinking about stem cells? You are the expert in the regenerative medicine field. What would you share with them to kind of get them up to speed in this particular type of therapy? Is it injectable? Is it oral? Give me the basics of what would a day in the life of someone participating in a regenerative therapy trial specifically like this?
Well, in our specific trial, of course, after contacting us and then we go through the process of evaluating whether they're candidates for the trial as the FDA has authorized it, they would come and visit us. And then, we would start our medical record process, some baseline testing, so we would understand where their disease is currently, and working closely with our rheumatology faculty here, who are our partners. We would then, if they agree and they want to proceed, we would actually put them in the context of an intravenous infusion. They would receive an intravenous infusion of these cells, which have been culture expanded under careful FDA guidelines by Dr. Gonzalez and his coworkers. They would receive the cells over the period of about an hour as an outpatient, and then they would, after a short time of observation measured in hours, they would be able to go home. And then we would follow up with them at several intervals, a month out, 3 months out, 6 months out, a year out. And we'd look at the course of their disease, and we'd look at the safety profile and the changes in any of the kinds of laboratory studies that we had done. And most importantly, how they're feeling and whether there has or hasn't been any change. So really, it's very straightforward in a certain way. There is some testing that's done, there is an infusion, and then they move forward.
Thank you for distilling that down. It sounds really doable. So, the most important thing that I want to do for our community is bring the best of the best to the table and to share ideas and possibilities. And, in our community, we really share a lot of vulnerabilities. And Karen, I can't thank you enough for, sharing your story, but also wanting to spread your success to other people, because this is just so kind and amazing and incredible. So Dr. Gonzalez, maybe someone out there is a little bit worried about some of the things that they've heard about stem cells, some of the ethical issues, like fetal tissue. Can you explain to me why these cells, and I know, Karen, this was a big issue that you and I talked about when we were considering this therapy. Can you explain to me the source of these cells and why this works so well in this kind of a study?
Yeah, 100%. So these cells are from post-birth, meaning mother is first and foremost screened prior to having the baby for different viruses. And in particular, with the cell lines that we actually have, we look for every single virus. One of the most prominent ones in the United States and in the world is Epstein-Barr virus, cytomegalovirus, which 75% of the patient population actually suffers from. We look for donors that don't even have this virus. So now we've eliminated 75% of donors out there. Then we screen, of course, for genetics by doing karyotype analysis, a couple different things. And then once we've obtained the ideal donor after they've had a baby, so post-birth, we obtain the umbilical cord tissue that's essentially just donated to us under an informed consent. And then from there, we start the process of extracting cells, growing them up, and making sure that they are the ideal cell source. for use. So these are post-birth considered adult stem cells.
Wonderful. And Dr. March, you know, in all of your experience in regenerative therapies, this for me has been the most exciting because of it's promising what I've seen with clients, but what we're also seeing in trials and studies. What do you think the power of this particular kind of cell is?
Oh, these cells have so many different influences depending on the circumstances, but in the context of immunity, they have the power to change the degree of inflammation and the degree of immune response, working by influencing a variety of the kinds of white cells or immune cells. That's seen in multiple models and in multiple early studies in other countries. What we want to do is test that circumstance, that power here. They also have the ability to help with blood vessel growth, providing support to tissues that may not have enough blood flow, and actually helping with cell survival. So maybe when we have another podcast, Haylie, we can talk about some of those other things that these cells might be able to do as well, and how there are clinical trials that are being designed to test those abilities as well.
That's amazing. And both Dr. Gonzalez, Dr. March, Karen, I can't thank you enough. Please, please, please promise me we'll do this again. There's so much more to talk about. Can I just ask you, because my community right now is struggling with finding the care that they need. Can each of you just give me a little parting word? Dr. Gonzalez, if you could start first, what should my community hold on to know that there are more and more progressive things that are happening that are going to drive us towards wellness?
Hope, number one. There's so much knowledge in nutrition, Haylie, you being one of them that helps out there with it. It's very, very important. Besides that, supplementation is really, really important. Before, it wasn't believed that it was that important, but it is really important. And understanding that there's support out there, that there's a ton of support that can help with anything. And I personally, I know Dr. Keith Marsh, Haylie, Karen, all of us are, that's why I think we feed off each other. And there's a lot of respect for each other, that we have a participation, and we want to help. That's the most important thing.
Thank you. Dr. March, don't make me cry.
We're looking forward to have the opportunity to help patients enroll in these trials so we can find out as soon as possible for whom what particular therapy will work. And I'll just build a little bit on what Rafael just said. I mean, we published a couple of years ago the importance of environment and the importance of, as Karen referred to earlier, chemicals. Well, one of the chemicals that people encounter, for example, are the chemicals found in smoking. So, you can really perturb the soil of your body, which, if you want to think of it in a certain way, we're seeding with these cell products, but you can perturb that by chemistry. You can also improve it by the chemistry that's created by, as you said, Haylie, earlier, good nutrition. Obesity leads to inflammation. Not obesity leads to not inflammation. So I think it's very important to look at the synergy between a healthy lifestyle, nutrition, and the potential for cell therapy when needed. And that's what we're trying to explore together.
Thank you. And both of these two doctors, I'll tell you guys, lead with their heart first and foremost, and are brilliant. And Karen, if you don't mind, just kind of wrapping it up and maybe giving people some hope. I know you have been through hell and back, and on that journey, you have dragged a lot of us along with you. I'm so grateful for that. But if you could just, talk to some of my community members and just share a little bit of your always wisdom.
I will tell you that it is a journey. And the first thing you have to do is you have to get your diet and nutrition under control. If you have weight on you, you got to get the weight off. And then you start with the next phase, which we're hoping for another alternative besides drugs. But even though stem cells would be considered a drug, they're more natural drugs. And that's why it's so important to do this trial so that the rest of the country can get these cells and hopefully treat their other autoimmune diseases as well as dermatomyositis and polymyositis. And that I hope that you get in touch with Keith Marsh and Dr. Gonzalez, and they can help you take the next step. Thank you.
Absolutely. Okay, guys.
Everybody, God bless. Be well.
God bless. Okay. Wow, everybody. That was a lot. So let me distill it down for you. autoimmune disorders have been treated for a long time with the same immunosuppressive drugs. And in many other countries, autoimmune disorders are treated with cell therapies. A lot of the more prevalent research and the more positive outcomes have been around what's called mesenchymal stem cells, or MCSs. I wanted to bring these two brilliant doctors, and just so you know, Dr. Rafael Gonzalez has been researching this particular cell line that's available in this study for decades. And then Dr. March has been the head of research in regenerative medicine for over 2 decades, together with one of my clients that have kind of been through it. She's been through the flare, the diagnosis, the immunosuppressive drugs, and she and I found the concept of going out of the country and doing cell therapies. And I've shared with you that I've traveled out of the country with many of my clients, Moscow, Spain, the Caribbean, Belize, France, to seek therapies that aren't available in the United States. Well, Karen, my client, wants to make sure that these therapies are available in the United States. So I wanted to bring to you guys the guy that developed the cells, the doctor that's running the study, the patient that insisted that this happen in the United States. And I wanted to bring it all to you to make all of these new ideas and concepts an option. You guys can register for that study if you'd like. If you feel like it fits you or one of your family members, you can also use this as an inspiration and a motivation to think outside of the box when you're struggling with something from a health perspective. And nothing but being healthy is an option, right? So someone once said to me, and I love this quote, but they said, I don't know how you do all that you do. And my response back is, I didn't really know that I had a choice. So with my own autoimmune disorder, I'm not looking to just fear the flare and survive the experience. I'm looking every day at ways to build on my health and thrive despite having this particular diagnosis. So let's think of it this way. When we have an autoimmune disorder, your friends, your family member, your loved one, yourself, your immune system is attacking itself. And through nutrition, through stress reduction, through supplementation, we're looking to rebuild and strengthen our body so that it doesn't feel that it has to operate in this state of dysfunction. Another option that we've looked at for many years is cell therapy, specifically mesenchymal stem cells. And so, as always, I'm trying to put even more amazing, incredible ideas on your plate. So we'll give you lots of data and lots of information. This is a big one. This is a lot to eat, a lot to process. But what I want you to know is that there is always ideas and hopes and solutions to whatever is stressing your body. All right. Love you guys.